How does diagnostic overshadowing impact mental health? Imagine trying to figure out what's really going on with a child, but every sign of distress gets overlooked or dismissed. That's what happens with diagnostic overshadowing. When a child has autism spectrum disorder, or autism, their behaviors are often seen as just part of autism. But sometimes, these behaviors hide other mental health issues like anxiety, depression, or trauma. Because of this, mental health symptoms may not get noticed or treated properly. For children with autism, emotional distress can look different. A child might become more irritable, withdraw, or have sensory sensitivities. Caregivers and doctors might think these are just typical autism traits, not signs of anxiety or depression. This mistake can delay getting the right help. Without proper diagnosis, children might not get the therapy or support they need to manage their feelings or develop resilience. Behavior changes can also be misunderstood. If a child suddenly acts out or becomes more withdrawn, it might be blamed on autism alone. But these changes could be signs of mental health struggles like stress, pain, or sadness. If these signs are missed, the underlying issues stay unaddressed, which can make the child's emotional health worse over time. Diagnostic overshadowing makes it harder to see when a child is really struggling. This can prevent them from getting tools that help them cope better. Without support, children may feel more anxious or sad, which can make it even harder for them to regulate their emotions. Over time, this can lead to more serious mental health problems. To reduce this problem, caregivers, teachers, and clinicians need to look carefully at behaviors and emotional signs. Using detailed histories and observations can help tell whether a behavior is part of autism or a sign of something else. Mental health assessments should consider how children with autism might show distress differently, like through sensory issues or changes in routine. Providing emotional regulation tools and resilience-building strategies that address both autism and mental health can make a big difference. When we recognize the signs early and treat the underlying issues, children can learn to manage their feelings better and build confidence. Addressing diagnostic overshadowing helps children with autism get the support they need to thrive emotionally and mentally.